There are people that enter into your life and you just know in that moment that your life is forever changed. I met Dr. Karol Watson in 2011. I had just returned from the Women Heart's National Symposium for Women Living with Heart Disease, excited to create my own support network at UCLA. Dr. Watson became our fierce advocate, and Elisa Beckett and I co-founded the first peer-led support group in Los Angeles for women living with heart disease. I am so honored to have sat down with Dr. Karol Watson. So, Dr. Karol Watson, tell us about how you got into this field of women and heart disease and why heart disease in women matters to you.
Heart disease is the leading cause of death. I always knew that, but I have a very personal experience because every female family member in my life had died of heart attack or stroke. I lost my grandmother, my mother's mother, before I was born to a stroke. I lost my favorite aunt at the age of 57 to a massive heart attack. Everyone had heart disease, and I realized there's so much we can do to prevent and treat and make sure we don't have these avoidable deaths any longer. So that once I realized that, there was no question what I wanted to spend my life doing.
We're so grateful for you and all that you do for us women living with heart disease. You've spoken about race and heart disease. Can you share more about your experience with that?
Well, as you know, many diseases strike people of color disproportionately. Heart disease is no different. And in fact, African American women with heart disease lose their gender advantage. So in general, women start suffering heart disease about 10 years after men. Of course, there are exceptions, but that's the average. For African American women, they completely lose that gender advantage. They start having heart disease and heart attacks and strokes at ages similar to male counterparts, and they actually end up having higher rates of some diseases like stroke than do white men.
Tell me more about that. Why do you think that is?
There are so many reasons for that. Some of it has to do with lifestyle. Some of it has to do with risk factors. As you know, hypertension is much more common in the African American community, but a lot has to do with social determinants, such as not having the money to afford healthy fruits and vegetables, or not having a safe place to live, therefore no safe place to exercise, not having access to funds to pay for all the medications you need. A lot of it has to do with that, and we as a society have to figure out ways to address that.
Now, part of the audience that I want to reach are women who don't have access. What can you tell them if they're sitting there and they don't even have a computer? Maybe they go to the library or they go to their church to log on. Is there something you can tell them to inspire them and to provide them with some type of hope?
There are so many good resources out there, but there are so many that are maybe a little questionable. I think the really important thing is to find a trusted source and get the information you need, and then seek care from a healthcare provider who can put that information into context for you, help you decide what's right for you personally, and make sure that you're on the right track.
Now, tell me more about the doctor-patient relationship. For someone who's watching this, they might feel like they're not connected to their doctor, or they might not feel like they trust them. Do you have something to share with them?
Trust is the cornerstone of any doctor-patient relationship. That actually has to be there. I also believe connection in my patients is super important. And one of the things I love the most about cardiology is that I've developed these long-term relationships with patients that I cherish, absolutely cherish. So, for instance, if you have a problem like an ulcer or a heartburn, you'll see your gastroenterologist until it goes away, and then you'll probably never see him again. But if you have a heart problem, you will see that cardiologist for the rest of your life. So I have patients I've had for 20, 30 years, and they've become very close to me. And we've seen each other through many life stages. And ultimately, because I actually do a good job at what I do, they survive their heart disease, but then many of them end up dying of other things like dementia or cancer or something else. And that's tragic to me, but a blessing to have had that experience for so long. I encourage everyone to look for a provider that they trust. And if you don't trust your provider, I think you need to look for a different provider. And certainly those long-term connections are very vital.
80% of heart disease is preventable. Can you tell us how patients can help to try and prevent heart disease?
Yeah, the food we eat is so critical. When we think about everything that goes on in our lives, the one thing we all consistently do every day is eat, every one of us. So what we put into our bodies matters. We understand so much more about what's healthy and what's not, but a lot of information gets filtered or gets kind of distorted. So knowing what we should do is difficult. That's why we work with trusted dietitians who can help us and our patients know exactly what they should be doing and should be eating. But the other thing you have to remember is food is not just food. Food is love to a lot of cultures. Food is care, and food is community. So we have to remember those aspects of food as well. So the thing I always say to people is, eat things that we know will make us healthier. But if you're going to eat something that you know will not make you healthier, make sure it makes you really happy and make sure there's a communal aspect to it.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart-healthy living. And remember, wellness starts with the heart.